Hi, everyone. Time to check in to see how Cobb County is doing with COVID-19. And for that, as always, we visit with Dr. Janet Memark. She's the director of Cobb and Douglas Public Health. We'll title this episode Holding Steady. Things are looking good, but not great.
We're holding steady, though, which is pretty good. So we're at 103 cases as of last night per 100,000. So that's still high transmission, but like I said, it is containable for us in the district right now. So we have over 20,000 cases, 20,213, and 436 deaths in the county.
So she mentioned things in Cobb County are containable. What does that really mean, and how long will that last?
When we talk about containable, we talk about being able to trace the disease and to keep it from spreading. And so when we have a case that pops up, you might have remembered back in March, we had a hard time doing the case investigation and contact tracing because there were so many cases that happened. And we didn't have enough people to do it back then. And so now we actually have a lot more staff and there's a lot fewer cases. So whenever a case pops up, we're able to call them, figure out where they were, keep them isolated at home so they're not spreading it, and figure out who they had close contact with so that we can try to keep them quarantined as well. That's part of it, and we're also able to test. So as you can remember previously, testing was very difficult to get. Now we have thousands of tests that are available just by public health per week, and if you get a test in the morning, sometimes you can even get that result back that evening. So we're doing really well on the turnover of tests as well as the availability of tests. So those things in combination keep the disease more contained, and the stuff that we continue to do, which is to wear our masks and to keep our distance a bit and to avoid crowds.
So testing still is available through Cobb and Douglas Public Health at Jim R. Miller Park and at several pop-up locations around the county, and results are coming back pretty quick. We've had a couple of people here who've had tests and have received results in about 24 hours, which is pretty darn good. So we're at a plateau. So what's really going on with that?
When we had the first wave, you know, it was from the March-April time. And then we had our second surge back in around July 4th-ish into that range. There was several things that might have contributed to that, and that was, you know, we had opened up the state. We had a lot of surge going around the country at the same time. We had protests happening. We had holidays. Big combination of things at that time that could have contributed to that large spike. And now we have been steadily coming down, but it looks like we are plateauing in our progression. If we were to go lower and to significantly lower, it would have to take some significant efforts for that to be done. So I don't anticipate that we'll go a whole lot lower than that. It seems like we're just kind of hovering. If we could stay there or go lower, that would be fantastic. But what we need to be mindful of is if we have an increase. We have holidays coming and we have school back in session. And so we have a lot more people in circulation. We're watching it really closely because a lot of the transmission can happen and be brought back to home. And with other people coming in for holidays or us going out, there definitely could be a chance for a perfect storm to happen.
So we are in this perfect storm scenario that they're really concerned about. Schools are back in session. The flu season is rapidly approaching. So far, how are we doing?
So it's fairly early right now. The schools have really tried to put some measures in place to quickly contain anything that may happen. So right now, we don't know a whole lot from what's happening with the face-to-face, but the ongoing issue that we seem to be facing is little clusters from athletic programs. It's not just school-based, though. It is even more private entities and things like that. So I wanted to kind of put everybody on alert about that. That seems to be a very common place that we're getting spread, as well as from businesses as well. We're seeing a lot of that, and churches. Please remember that. You know, I know they put a lot of measures in place, and the more that we open up, we have to try to keep some of those measures, which is the distancing and the masks, and try to be outdoors as often as we can, because it does seem to be a place where the virus likes to transmit.
We talk about that perfect storm. We're worried about the flu season approaching. Flu vaccines are available and becoming increasingly easy to get. How is that flu season looking so far?
Yeah, so we aren't seeing much flu activity quite yet, so that's good news. There are some flu shots that are coming out. in different places. If you see somewhere you can go get a flu shot, please go get it. The supply of flu shots is coming, but it's a little bit slower than we anticipated. So if you can go get a shot, get one. We will have, this is the first time in a long time that we will have 2 potentially deadly viruses that will be circulating at the same time. So you can protect yourself against one, at least some protection. And we may get lucky that it'll be, you know, a 60% protection this year, but we're going to get lucky that if we do our measures like the masks and distancing, that the number of flu cases will decrease. But our area hospitals are very busy right now, and that is, it's not just COVID, it's not flu. This is just they are very busy hospitals, and so some of the intensive care beds are low as well as medical surgical beds. So what I also wanted to tell people was that if you are having any sort of chronic diseases or symptoms that you need to take care of, please go and take care of that. A lot of people have been avoiding hospitals and their doctors because of COVID, but that is causing people to come in with more serious effects of their chronic diseases. So please do not avoid care because you're just causing some more problems for yourself, and the hospitals are very busy. So go ahead and do what you need to do and take care of yourself.
So the lesson from all this is if you're sick or you have a medical condition, get that looked at right away. Don't wait, because they've often become serious enough it requires a trip to the emergency room. Hey, you may have heard of something called antigen testing, and you may have heard those tests are coming here to Georgia. They are very quick tests, but Dr. Memark says quick does not necessarily mean better.
Antigen testing is a new buzzword, and you probably heard that the federal government has purchased 150 million of these quick rapid antigen tests that will be going out. We've already received some in our area and are already trying to figure out where they're going to go and who needs them the most. Now, antigen testing, antigens are, you might have heard about antibodies and antigens. Antigens are a response that your body has to having a virus in it. The antibody is when you have developed an immune response, and so we measure that if you've already been exposed. The antigen shows the acute infectious phase, and so that is what the antigen testing is testing for. The only issues with this is that it's a little bit harder to pick up on antigen testing, and so you do need to be in the infectious period to be able and have symptoms mostly to be able to test positive on that. We're going to be receiving some of those Binax Now cards, which are the ones, the 15-minute ones that you can do with a nasal swab to get those tests. And so we're talking to some of our partners where they may most be needed, that we can help to distribute some of those. Now, what I want everybody to know, though, is the antigen testing, if you become positive on that test, you are positive and infectious for COVID-19. That has to be reported so that we can do the same process that we do with the other tests. So I wanted to make sure everybody knew that, because there's some confusion about that, because the antibody test is different. It's from the past infection, and antigen is a present infection. So please, if you get that, or if you are confused, please give us a call and let us know so that we can follow up on that.
Of course, one of the big COVID-19 pieces of news nationwide is the fact there's been an outbreak in the White House, and even the president himself has gotten COVID-19, gotten the coronavirus. Dr. Memark says that's a good education, that testing doesn't necessarily keep you safe.
People have been talking about President Trump's diagnosis of COVID, and somebody who is as protected as he is and who gets tested very often, as well as the people around him are getting tested a whole lot. How did he become positive for COVID-19? And I thought that was a really good example for all of us to learn from. So to get a test for COVID-19, that's a test at that moment, and you can be negative, or you can even not have a good enough sample at that moment that didn't pick up on it, but you're negative for that moment. The incubation period of this virus is 2 to 14 days, and sometimes even longer. And so you can pop up positive. Once you finish that test, you can become positive right after that. And so it gives you a false sense of security, because people can get tested and they're not, if you all got exposed around the same time, you're going to be popping up positive around the same time, or throughout this period. And so I didn't want people to have that false sense of security. The best thing you can possibly do is to do those measures, which is to have the mask on when you're in public and to socially distance yourselves and wash your hands, get your flu shot, and avoid crowds. That's the only thing that we know can work right now, because the test is not 100%. None of these tests are. And so the only thing we know for sure that works is the prevention methods that we talked about.
Again, we're kind of in this plateau area, and Dr. Memark says those 3 W's, wear your mask, wash your hands, watch your distance, is more important than ever as we head into these upcoming months.
We are holding steady in Cobb County, but we've got a few things that are making us kind of put our radar up, right? We have schools back in play, we have holidays coming, and we have lots of outbreaks throughout the country that we really need to be keeping an eye on. So remember, as people start traveling more, there's a much higher risk that we're going to be affected as well. So please do not let down your guard. This is the best we've done, and so we don't want to lose that, okay? So let's keep going and do all the things that we need to do.